Hello guys, welcome back. Today let's discuss about diphtheria. Diphtheria is an acute infectious disease of mucous membrane or the skin caused by Corynebacterium diphtheria. It's a gram-positive bacillus secret potent exotoxin. Usually affect tonsils, throat, nose, skin, very rarely the heart and nerves. Disease is generally characterized by local growth of the bacterium with pseudomembrane formation. Diphtheria can be treated with medication, but in advanced stages, diphtheria can damage the heart, kidney, and nervous system. Even with treatment, diphtheria can be deadly, especially in children. The signs and symptoms are like thick gray membrane covering the throat and tonsils, sore throat and hoarseness, enlarged lymph nodes in the neck, difficulty breathing or rapid breathing, nasal discharge, fever and chills, tiredness can be there. Mode of transmission spreads through droplet infection during coughing, sneezing, or by conversating. Transmitted by object contaminated by nasopharyngeal secretion of suspect, direct person to person by contact with respiratory secretion and cutaneous lesions. Main clinical features are incubation period is 2 to 5 days, onset with fever, sore throat, malaise, headache, and weakness. Period of ineffectivity is 14 to 28 days from the onset of disease. Types of diphtheria: pharyngotonsillar diphtheria, laryngotracheal diphtheria, nasal diphtheria, cutaneous diphtheria. Pharyngotonsillar diphtheria: sore throat, difficulty in swallowing, low-grade fever, in early stages whitish membrane which can be wiped off easily over pharynx or tonsils. Later it becomes thick, blue, white, grey, black or adherent. It is difficult to remove. If tried to remove, it will result in bleeding. Mucosal erythema around the membrane, edema of submandibular area, bull neck appearance. Laryngotracheal diphtheria, it is preceded by pharyngotonsillar, hoarseness of the voice, brassy cough. Nasal diphtheria, unilateral or bilateral blood and serous fluid discharge from the nose. Escoration of upper lip. Toxemia is minimal. Cutaneous diphtheria. It is characterized by shallow skin ulcer which can occur anywhere on the body and are usually chronic. Here you can see some photos of the cutaneous diphtheria. Diagnosis can be done on physical exam to check for swollen lymph nodes, medical history, and symptoms. Clinical examination of throat culture from the infected area and blood test. Gray coating on throat or tonsillar to confirm the diagnosis as a sample of the affected tissue and sent to a laboratory for testing. A throat culture be taken suspect diphtheria of the skin. Diagnosis. The toxigenicity of the diphtheria strains is determined by the variety of in vitro or vivo tests. The most common in vitro tests for toxigenicity are ELEC immunodeficiency test, polymerase chain reaction, enzyme-linked immunoabsorbent test, immunochromographic strip test. Complications are like respiratory failure, occlusion of the airway by the membrane, myocarditis occurs in the second week, can lead to CHF, apnea or sudden death. Neurological can be palatal palsy, ocular palsy and loss of accommodation and polyneuritis. Neural complications can be oliguria or proteinuria can be there. Management is the confirmation of the diagnosis by appropriate bacterial cultures and administration of antibiotics and antitoxins. Appropriate supportive care include special attention to maintaining an adequate airway in the presence of laryngeal or extensive pharyngeal membrane and to be careful monitoring of the cardiac rhythm disturbance or other manifestation of the myocarditis. The patient has to given in treatment after the disease is suspected. A delay in treatment can result in death or long-term heart disease. In severe cases, there is obstruction of the throat which may be require intubation or tracheostomy. Antibiotics are used in patients or carrier to destroy the diphtheria bacterium and prevent its transmission to the other. Prevention can be by diphtheria can be prevented with the use of safe effective vaccine Most people receive their first vaccination of the disease as children. This is called DPT vaccine, diphtheria, tetanus, pertussis. And by strict isolation of the infected patient to prevent transmission, replacing T with TD can help to disease outbreak. Let's summarize the topic. Diphtheria is an endemic respiratory tract communicable disease. Comes under 6 killer disease caused by chorionic bacterium diphtheria. Commonly seen in children less than 5-year-old and in winter season. Mainly in 4 types: pharyngotonsillar, laryngotracheal, nasal, and cutaneous. Early detection and treatment is best way of prevention and control. Thank you.